is a book review of The Spirit Catches You and You Fall Down by Anne Fadiman, written in 1997. The tagline of this book is A Hmong Child, Her American Doctors, and the Collision of Two Cultures. The author, Anne Fadiman, tells the true story of a Hmong girl, Leah Lee, who has epilepsy, and details her family's journey as they seek to manage her condition. Leah's family moved to United States of America shortly before she was born. They live in Merced, California. The Hmong is an ethnic group from the mountainous regions of southern China, Vietnam, Laos, Myanmar, and Thailand. The Lee family came from Laos, having fled because of the war. What does the book set out to do? By telling Leah Lee's story, the book shows us that there is a conflict if two different cultures will have to resolve an issue based on their own beliefs and traditions, in this case, the medical management of Leah Lee's condition. It describes the cultural differences between the Hmong and the Western world and how cultural differences can cause a conflict, especially in healthcare settings. As in the book, problems such as language barrier caused a mistrust between her parents and her doctors and prevented Leah Lee from recovering effectively. Excuse me. The book detailed how Hmong culture perceived health and illness through their cultural beliefs as well as medical beliefs and how it became a problem to the American doctors who also have lack of cultural sensitivity. The Hmong think of epilepsy as quag dap peg, which means the spirit catches you and you fall down. They believe that spirits cause the condition and that it is a gift or a blessing that is given to Leah. It gives us insight on the importance of understanding and respecting cultures other than our own.
If we look into how does the book contribute to the topic it addresses, we think this book provides a unique analysis by telling an interesting story of a child named Leah. It confronts the readers with the extent of the catastrophe that can ensue in a case of cross-cultural misunderstanding. It also gives new knowledge about Hmong culture, for example, that they bury the placenta where the baby is born because it is considered a finest garment for them. After the death, it is thought that the soul comes back to put on the garment again. It explains about the misunderstanding due to cultural and language differences affecting the lives of people who were refugees or migrants from other parts of the world. Fediman tells a real life story with such depth and undoubtedly provided a new and much needed perspective on the topic. The book is an eye opening display of the power of parental love. It shows how crucial it is to be respectful of other cultures and to really do all you can to make sure that the patient understands exactly what it is you are asking of them and that they understand your point of view on their illness.
In the question of very important ideas or information not taken into account, we believe the book has conveyed exemplary ideas and information to the public. The author worked on it passionately for 9 years. The book makes us realize that although the medicine has made great advancements, cultural diversity still occurs, and in many cases, there is a clash of cultures. Although the author showed two sides of cultural differences, it implies also it was never resolved. In real life scenario settings of cultural differences, issues in many places must be addressed, particularly in healthcare settings. As a group, we don't think the book misses anything and neither needs to be updated. The book was written in a very extraordinary way, describing every detail clearly, especially the traditions and cultures of Hmong. Although what happened in the book in the 1980s would hopefully not occur in 2017. The book should remain as it is to provide a lesson what can happen if a patient's or patient's family's beliefs are misunderstood or disregarded by medical professionals.
The next question was, were there different responses to the book arising from our diverse cultural or professional formation? Yes, we as a group had different responses because we have come from different parts of the world, from India, the Philippines, and Australia. Some group members could relate to the traditional monk healing treatments as similar methods are used to treat illness in their backgrounds. For example, in India, Ayurveda uses natural things such as plants, flowers, roots, and seeds to treat pain, fever, etc. Some of us started the book with the belief that Western medicine is the best way to treat medicine, but in many instances, the treatments provided to Leah by her family served her better than Western medicine, which opened our eyes to another viewpoint. Some members of our group with a clinical background have encountered patients who have superstitious beliefs based on their ethnic background, religion, or provinces where they come from. We all agree that it was because of the monks' cultural and spiritual belief that Leah lived 26 years in a vegetative state. Most people survive only 3 to 5 years in this condition. If Leah's doctors had been better attuned to the monk understanding of medicine, perhaps Leah would not have suffered as much as she did. Sometimes it is difficult to bridge the gap between medical practices and cultural beliefs, but it's important not to disrespect anyone's beliefs.
What are the book's implications for healthcare, public health policy and practice? It is well known that Australia, particularly Victoria, is one of the most multicultural societies in the world. There have been many waves of migration from various countries since Australia's earliest days. Indeed, Victorians come from more than 200 countries, speak 260 languages and dialects, and follow 135 religious faiths. The cultural differences of the groups who have migrated to Australia need to be taken into account when treating them, and in many cases we believe that they are. However, one group where a clash of cultures is regarded to have negatively affected health outcomes is Australia's very own Indigenous people, the Aboriginal and Torres Strait Islander populations. The goal of closing the gap is moving slowly, and this is partly because the Australian approach to medicine does not sufficiently take into account the cultural sensitivities of its Indigenous populations and their beliefs around treating illness. According to Michael Marmot, after social disadvantage, the relationship of Indigenous people to mainstream Australian society is the second class of influence to which the poor health of Indigenous Australians can be ascribed. We believe that the spirit catches you and you fall down absolutely has implications for Australia. Most significantly, the implication is that Australia needs to focus on culturally competent care for Indigenous Australians and migrant groups. To this end, we feel that when the government is seeking to establish any new public health policies or programs, they need to consider Australia's cultural diversity. They should focus on policies that can be applied to all ethnic and religious groups, taking into account their corresponding beliefs.
So, what recommendations would we like to make after reading this book? This book provides proof of the importance of being respectful and sensitive to the cultural beliefs of patients, and to see the patient as a person, not just to focus on what is medically wrong with them. Ethnography and cultural humility, responsiveness and sensitivity training should be included in all medical degrees. Arthur Kleinman's explanatory models approach should be taught to improve communication between doctors and patients and to make it more open and understanding. Patient-centred care is a great model, and if the patient has beliefs outside of Western medicine, a combination of Western medicine and traditional healing is the best way forward. We also think it's important that if a doctor starts working in a hospital or clinic that is located in an area with a large minority ethnic or cultural group, the hospital or clinic should provide compulsory classes on their culture and beliefs, and there should be translators and social workers available. The Afterword by Anne Fadiman for the 15th anniversary of her book mentions that in 2009, the Merced Hospital, where this story occurred, instituted the United States' first formal shaman policy, allowing certain ceremonies to be performed at the patient's bedside. This shows that the hospital is now much better equipped to provide compassionate care to the Hmong. In an increasingly diverse society, doctors and medical staff must learn to value ethnic and cultural diversity in order to deliver effective healthcare to everyone. And here is a list of the references we used. Thank you.